All right, yeah. So sorry about that. I apologize and hope that this will be able to move on very well. So this just to show us the presentation and where the Kenya is located on the east coast of Africa. And I just mentioned about Kenya population and our devolved government. And it's at this point that I was just sharing with us that when you look at the healthcare spending budget comparatively between the USA, Brazil, and Kenya, you find that Kenya is quite low, spending about 4% of its GDP on healthcare per se. And comparatively to, USA and Brazil. And this just the same graph in terms of line graphs, and just to bring the picture at home. But just to bring some, as you can see in this slide, we are in the pandemic, and you can see Kenya has been going through the various waves of COVID-19, and we are now starting another wave. As of yesterday, we are under 14% of cases detected. And that really brings us to understand the issues about IPC. Now, this picture, I brought it here so that you can just bring into our attention and be able to understand how people perceive their IPC, and in various sectors, depending on whether you are trained in either a surgeon or what leading a healthcare facility. And from that picture, you can see that the person who took this picture said, yesterday I was walking and low hands with my wife, and suddenly dropped her hand and grabbed my cell phone to take this picture. She hit me in my chest and couldn't talk to me the rest of the day. Last night she asked me, how could you? And I said, how could I not? It's not every day you see a dog driving a car. Basically what I was trying to bring about is that different perception have different ideas of IPC. And basically, we all know, and I know you've been discussing this over the past few days, that IPC is mainly a technique whose primary purpose is to prevent microorganisms reaching the susceptible site on a patient health staff and control the spread of this same infection when they occur. And their basic requirement for IPC being its safety, quality of care, outbreak preparedness, and critical element of readiness. In that view, IPC should be an ongoing activity undertaken and supported by a national program, IPC focal point teams and committees, healthcare facilities, senior management officials, and all staffs at all levels. I'm sure you must have discussed the core components of IPC, and to have an IPC very effective must have these core components. And if no IPC knowledge, system, organization, and resources are in place, then it's unlikely that that country or a facility is able to respond effectively to an outbreak like we've heard about the COVID. So IPC is really strategic and very important. Now, looking at a case study of Kenya, and this just to show you the IPC, where it sits in Kenya. We have the Ministry of Health, and under the Ministry of Health, the big one, we have Directorate and Health Standards, and within that Directorate, we have the Department of Quality Assurance, and that's where the IPC sits, which is referred to in Kenya's Division of Patient and Health Work Safety, meaning it has three divisions: the infection prevention, control, antimicrobial resistance, and the patient and health worker safety. This just to blow out from the Ministry of Health, we have the regulatory bodies, the patient safety IPC, and then the regional government, where we have the county health services, and then the focal points at the facilities. This slide just wanted to bring to attention the journey and the milestone of IPC program development here in Kenya. And as you can see that it started as a pilot project by various partners, and this was John Snow International in 2006. And so through all this, and then there was the birth of IPC policies, guidelines, and then the IPC conference in 2011. And from there, we formed an IPC professional we referred to as Infection Prevention Network, and then in 2013 we had our third IPC conference, and this has been going on until we got the late March 2022, we had our 9th Infection Prevention Conference. But as you can see, it has been a journey development of various documents which I will take us through. So the Ministry of Health with various partners and stakeholders has been carrying out several activities in an effort to address problems of healthcare-associated infections. And there have been several successes and challenges experienced in the implementation of these activities. I would like us just to take us now a journey in terms of just to experience some of these successes that we have implemented and succeeded. So since 2009, when this program started, very well, as you've seen in the journey, we developed various documents, and one of them is this, the IPC policy in 2010 that has been revised to 2021, and it's mainly the importance of this is the IPC policy agenda puts it in the health sector, establishment of IPC committee and secretariat, and improved coordination of various partners and stakeholders in IPC, leading to maximizing of available limited resources. We have the strategic plan that was developed in 2014 to 2018, and this has been revised now in 2021 to 2025. Now, the strategic plan, it's really, the main issue is to implement the IPC strategy, monitor and hygiene adherence, and establishing a national HAI surveillance system, develop and review accreditation systems and quality assurance standards within the country. We have the guidelines that have so far been also revised from 2010 to 2016, which are being implemented, but we'll see some of the results of this. And these really are the key components of our IPC guidelines. Talks about how the IPC program is coordinated as standard programs, how the patient flow and traffic flow within our health facilities, IPC in specialized areas, and how HAIs can be prevented in the local setup. We have the policy on healthcare and injection safety management that have been developed, waste management documents, and antimicrobial resistant policy and the action plans that have all been developed as we are building capacity and developing the IPC program here in Kenya. Now, the strategy in terms of AMR has 5 key strategies in terms of creating awareness, surveillance, infection control as a component, antimicrobial use, and research and development. And these are the various documents to support the AMR surveillance here in Kenya. We've also established an ECHO project whereby we talk about the AMR surveillance, AMR activities, and IPC programs HAI surveillance, just to educate and improve capacity building at various far-flung facilities here in Kenya as a national program. Now, one of the main national strategic priority here is really enable the management, leadership, and governance of IPC, advocacy and behavior change and communication in IPC, improving the health work, education and capacity, and more so on IPC surveillance, notifications, and research. Now, having just taken you a journey of where we are in IPC and how we have developed, and then WHO within the and with the ministry and other stakeholders conducted an assessment just for us, which was internal to using the ICAT to see where we are in terms of our IPC in this country. And this line just shows us the results. And as you've seen that most of the areas like documentation guidelines were scored very well, as you can see almost 100%, but areas like monitoring and audits of IPC 40%, IPC program 8%, and of course using multimodal strategies scored 800%. And this really showing you the areas that as a national program they were able to be achieved, and key areas that really scored very well, as you've seen the previous line, were multimodal strategies and IPC guidelines. Now, when COVID came again, we developed to understand our health facilities, how prepared they are, and how our IPC program, apart from the national, is up to the facility level. And we used an adopted tool to assess the health facility assessment, and we assessed about 844 facilities in the year 2021. And in Kenya, the health facilities are graded according to their status in terms of the services that they offer. We having level 6 as the most specialized, like the National Referral Hospital, level 5 at the various county government, and level 4 primary facilities. And this just showing us, how these facilities are scored in terms of various areas of IPC. And you can see in terms of environmental cleaning and disinfection, scores are very high. But in terms of handling COVID-19, bodies at that time was very low. And we all understand that it being a new pandemic, new pathogen, very little knowledge was understood in terms of how this COVID was being spread. But again, looking at the proportion of facilities meeting guidelines for screening and triaging, I can see it was really quite a mix in terms of having the various components for triaging, and having a well-ventilated was scoring 91, and having some thermogans 94 of all the facilities are assessed. But healthcare workers being provided with at least 2 surgical masks per day scored very low, which was at that 4%. And that's why you remember I shared with us in terms of health spending budget by the government. Transitioning on in terms of healthcare associated infections, we all know about healthcare infections, 500 patients each day in hospitals, and really contributing about 16 million deaths every year across the world. And it's like really having a juke budget, crashing every day when in terms of having an HAI. So if we could consider and be able to understand that the damage that HAIs causes within the healthcare system, then most health managers would put it into a better perspective than it is. This slide is just showing us in terms of how we've been able to evaluate and look at hand hygiene and healthcare associated infection in some facilities. And in one of the ones showed that really as provision for hand hygiene was good, then the HAIs were low. But when the hand hygiene went down, the HAIs went up. This slide is just to show us in terms of compliance rate by various countries here in Kenya over a period of time. And as you can see that as we continue to monitor when there are new staff or new students, issues about shortage of water, IPC coordinator not being present, then the IPC scores went very low as less than 5%. We've been able also to look at the prevalence of antibiotic use in various facilities, and you can see that as IPC is all inclusive, and you can see that the use of antibiotic has been quite on rise, and you could see there, in a pediatric ward at that time were 56%, and of course at the critical area care, 70% of the patients were on antibiotics. But what kind of antibiotics were being prescribed in these facilities? It is as we did it in the national. You can see that amoxicillin and enzyme inhibitors were the highest prescribed molecule, followed by ceftriaxone. So these are the common antibiotics that are prescribed across the country. And this really information helps us and helps the country to build a good, strong IPC program. Now, out of that, we set up surveillance for AMR, and in 2017, we had 2 sites, and by this year, we are hoping to increase to 28 surveillance sites. That will be able to give us more information about the antibiotic use and the resistance across the country. Now, this slide is just to show you, because as I'm just enabling us to understand the challenges and the successes in terms of infection control, and this from one of the facilities that has been supported by various partners to monitor MRSA and improve in terms of various methods using the QI quality improvement methods. And as you can see at baseline, they had quite a number of infections of CLABSI, and as they improved in terms of implementing various methods by inducting every nurse that was there, training them, having standardized way of cleaning the environment, went a long way into improving the CLABSI in this facility. Now, turning on and just looking at what are our key challenges at the national and the sub-county or the regional government. One of the things that we have noted is that in such a setup, there is quite under-resourcing of IPC national coordination mechanism. The Ministry of Health has very little budgetary allocation for IPC, as you saw that the whole budget from the national government for Ministry of Health is very small, not even up to what has been agreed by the African countries of 15%. And in some counties, there is no budget at all for IPC. And therefore, that brings a lot of challenge in terms of implementing some of those successes and areas that you've seen me share. There is also poor knowledge and skills of frontline healthcare workers, attitudes, infrastructure, and difficult to implement IPC in these areas, lack of hygiene facilities, poor ventilation, and lack of clinical isolation areas, both in the outpatient and in the inpatient. In terms of staffing, there is very low patient staff ratio, SOPs and job wins to guide in terms of IPC procedures in quite a number of the facilities, maintenance of the infrastructure, and as you saw in the evaluation that was done by WHO, lack of adequate PPE and other equipment to support the IPC. And as we conclude, just to show you that some of the IPC practices and what we've been able to improve in terms of small areas in various facilities, consider issues about injection safety, but these are so far improved into better practices whereby we have injection safety boxes across the country. We had issues about waste management, and now most are burning and are able to segregate their waste, as you can see in this diagram. In the issue about waste management, again, you can see that things have continued to evolve from burning, open burning, to secure areas of incinerator, trained personnel, and having them PPEs, hand waste and hand hygiene well placed, and in areas that there is no water flowing, we've had some improvisation of hand washing stations. In terms of areas and waiting bays, improving knowledge and the skills, you can see that in this area, before a facility and an IPC program, they used to store their commodities even in the waiting bay, but after educating and having them understood the importance of IPC and how ventilation is important, they improved that. Establishing new triage systems across the facilities to be able to monitor and record their patient, including in the lab management. And as come to conclusion of this, one of the key things that we've learned is that common attributes for successful strategies are four: is engaging and to motivate the key stakeholders, meaning the government and other partners, educating the key stakeholders to understand the importance of IPC so that they are able to allocate funding and resources for IPC, and then executing IPC practice to standardize care processes and evaluation of and to understand whether IPC practice is successful, as we have seen. Now, IPC should ensure that they have planned to address each of the four E's: targeting key stakeholders, senior hospital leaders, and improvement of team leaders and healthcare workers. This just to show us that we are work in progress as a country. We working with the bi-monthly technical working groups, identifying them by strategic priorities, and then mounting a training program for healthcare workers. And they are able to share their experiences in Infection Prevention Network conference. As I close, and this is my last slide, which I like, it's just to show us that hand hygiene and various how we spread microorganisms across our various facilities, and it's important that all of us as healthcare workers to understand and to be able to know that infection control and prevention is for everyone and needs to put it in place. So as you see this script, just to remind us that as healthcare workers, hand hygiene is a major transmitter of pathogens within the hospitals. Disinfection is very important, and we need to really make sure that we are able to practice this across board. As you see, how infections are spread across the hospital and into various members, and then it's very critical and very important for us. So with that, I want to say thank you, and just to give thanks to various partners that have been supporting IPC program here in Kenya. And with that, thanks, and back to you, Carlos.